Thank you, and thank you to Tali and Little Steps for inviting us today to speak to you about utrophin and the very encouraging early results that we've seen in our phase 2 clinical trial so far. So the really exciting thing about utrophin is it has the potential to treat all patients, regardless of age, regardless of what mutation they have. So we call this a potential universal treatment for DMD. Now, we are a publicly traded company, so we have to show disclaimers like these, but I do not need to read it to you today. So we are located in the UK, but I'm based out of our US office in Cambridge, Massachusetts. Our technology comes out of the University of Oxford from Professor Kay Davis's lab, and she discovered a long time ago, actually 30 years ago this year, she discovered utrophin. And the reason she found it is because it's so much like dystrophin. And so what she thought is that if she could get boys to make utrophin in their muscles instead of dystrophin, that this could be a great treatment option for patients. And so our company was founded to find drugs that could get the muscles to make utrophin in place of dystrophin. And I want you to remember a couple of important things about utrophin. First, as I said, it has the potential to slow or stabilize disease progression in all patients. And again, that's because it's independent of the gene mutation that the kids have. And this also could be complementary to all other approaches that you hear about in DMD. And in that vein, we do have a collaboration with Sarepta Therapeutics. You'll hear from Madeline later. But in this collaboration, they would take over selling any of our utrophin modulators in Europe if they get approved. But until then, we get access to their expertise in developing drugs in Duchenne. So as I mentioned, utrophin and dystrophin look and act very much alike in the muscles. And we like to think of these as shock absorbers for the muscle. So it's kind of like springs on a trampoline. And without these, you're in trouble. And they do the same function, but they do so at different times in muscle development, as you heard a little bit earlier. So utrophin is actually present when a muscle is first developing or when it's repairing, and it's present in all of us. But then for whatever reason, we're still not sure why this happens, but utrophin turns off, and dystrophin comes on to take its place. Now, in the case of Duchenne, utrophin is still there. It's still functioning as it should. It comes on when the muscles are being repaired or developed. And in fact, there's a lot of utrophin that's there because the muscles are being repaired so often. But it also still shuts off. And dystrophin doesn't come on to take its place. So we have a muscle that's vulnerable to breaking down, being damaged, and undergoing this constant cycle of damage and repair. So what we're trying to do is keep that utrophin turned on, so it never turns off in the muscle, and you have a muscle that can function with the presence of utrophin instead of dystrophin. So we are in a clinical trial now, and I have some exciting results to share with you. But before we get there, we always like to thank the patient organizations that have helped us get where we are, as well as the families, the patients, and the physicians that have been involved in our clinical trials. So our clinical program is really set up to answer some key questions. And in our phase 1 clinical trial, the question that we had was, is this well tolerated? Is it safe? And can we test it further? And so we've already checked that off. We found that it was well tolerated in about 100 healthy volunteers and 22 individual patients in our phase 1 trials. So we're now at the phase 2 stage, and here we can ask, can Ezutromid, which is our drug, can that modulate utrophin in patients with DMD? So can it make utrophin when it's not normally there? And can Ezutromid have a positive effect then on the muscle structure and its health? And in future trials, we want to ask, does this then have an effect on the function of the patients and their quality of life? So our phase 2 trial is an open label trial, and that means that every patient is getting access to Ezutromid. We had 40 patients total enrolled at sites in the US and the UK. Now what we're really looking for here, a couple different things. So one, as I said, that muscle health. So for that, we're looking at magnetic resonance parameters of the leg. So this can tell us information like, is there inflammation in the muscle, or is the muscle being replaced by fat, and are we having an impact on that? And we can also look at the biopsy measures, and there we can look, again, at muscle health to look at how much damage is happening, and we can also see, is utrophin being expressed? So we announced data from the interim look earlier this year, and we're coming up on the full data, which we expect in the third quarter of this year. So our endpoints are really set up to follow the disease over time. So the short-term impact that we would expect to have is really on this damage and repair cycle. So what we know is that the muscle, because it doesn't have dystrophin, it's unstable, and it starts to undergo that muscle damage and repair cycle. So to look at the stability of the muscle, we measure utrophin. To look at damage and repair, we look at this measure called developmental myosin. And we also look at magnetic resonance in this measure called T2 that can look at inflammation. And finally, over the longer term, we know that this cycle of damage and repair isn't perfect. Eventually, the repair doesn't happen again, and so the muscle gets replaced with either fibrosis or fat. So we can measure the amount of fat that replaces the muscle with this magnetic resonance fat fraction, and we can also look at the loss of function further down the line by looking at things like the 6-minute walk test and the North Star ambulatory assessment. So what we've seen so far is making us very excited. So we've seen a short-term impact for these kids so far. So we first showed that we've stabilized these membranes, and that's because we found that there's still utrophin being made after 6 months of treatment. We found that that then led to a significant decrease in muscle damage. And then also we saw a significant decrease in inflammation. So I'll show you a little bit more about those last two. So this is a picture of a muscle biopsy from our trial. On the left-hand side is before treatment, and areas of blue are marking that recent damage, so it's marking developmental myosin. You don't really need to know what that is, other than it marks areas of the muscle that have recently been damaged and are now undergoing repair. And so after 24 weeks of treatment, we see that this dramatically decreases. And we think that this is really meaningful because when we were setting up this test to be able to look at that marker, we looked at a range of patients with Duchenne, with Becker, and those who didn't have either of those conditions, and found that in general, the amount of that blue corresponded with the severity of the disease. So we think we could be having a significant impact on the severity of the disease for these kids. And further, we showed a significant decrease in inflammation. So again, this is through that magnetic resonance measure in the legs. And we found that in the calf muscle, there was a significant decrease from baseline. This is on top of steroids. So you would expect this effect from steroids right away, but then that stabilizes. So these kids have all been on stable steroids, and we're showing an additional decrease in inflammation. We also showed a decrease in inflammation in the thigh muscle too, but that wasn't quite significant. So as I said, we believe that we're having a short-term impact on the disease for these kids, and that eventually this will lead to long-term benefits. So now at the 48 weeks, we'll be looking to see much of what we've seen so far, and potentially also see either a slowing or a stabilization of that fat fraction increase. And further down the line, perhaps in our extension phase after 48 weeks, we might start to see a slowing in the decline of function. So what's next? If we have positive results, as we've seen so far from PhaseOut DMD, we have two potential options. So one, we could go on an accelerated path where we would go to the FDA and the EMA and ask them to approve this drug based on the trial that we have. We would need to do what's called a confirmatory clinical trial to show that what we've seen in this trial is actually true while we're able to sell the drug. If we go the traditional path, we would have to do a clinical trial next and then ask the EMA and FDA for approval. We're hoping that we can go for the accelerated path, but it remains to be seen as to what the data actually show us. And we are currently in discussions with a couple of the physicians here to have the next trial be in Israel, but we can't confirm that that's the case until we have signatures on paper for that. But if you'd like to hear news from us, you can sign up at utrophintrials.com. I send out periodic news about our program and the updates that we have for the family members. This is in English, but you're welcome to translate it on Google Translate as you wish. And finally, here's my contact information, my email and phone number, and I'll take questions after this session.